Greetings to everyone. Myself, Ruby Malya, dietitian from Chandra Rheumatology, Immunology and Research Center. Today, let's discuss about dietary management in gout. So first, let's discuss what is gout. Gout is a form of inflammatory arthritis. It happens when there is a crystal formation. That too, when there is an increased level of uric acid in your blood. So this uric acid forms into crystal and it gets deposited in the joints of your body. This crystals causes you the pain, stiffness, and swelling, and this is called as a gout. So it is also called as an acute gouty arthritis or acute gout attacks or acute gout flares. So next thing is like how let's discuss why there is an increased prevalence of gout the recent days. First thing is like change in lifestyle and dietary management. It is mainly because people are now shifting to modernized diets that too going for fast foods, processed foods. They doesn't have that much time to cook and eat for themselves. Next thing is like increased prevalence of comorbidities like hypertension, vascular disease, and obesity. This is next is the increased longevity. That is like before days, people used to live up to 60 or 65. Now, due to increased or advanced health medicine, people are living more than 100 years. So the organs fail to work as before, since we are living for a longer time period. And the second thing is like increased medication. People are even the small child is also taking lots of medication nowadays. This also leads to gout formation. So now let's discuss how food contributes to gout formation. The first thing we have to understand is like how these crystals are formed. Usually in our body, purine, it is a amino acid, a type of an amino acid. This is present in our body. This purine breaks down and it forms into uric acid. This is a metabolite of purine. So when the uric acid level is increased, the kidney tries to eliminate it out of the body. So this is the normal procedure happening in our body. But when the purine breakdown is more and there is an increased uric acid level in our body, but the kidney couldn't eliminate this uric acid, it leads to increased level of uric acid in our body. This leads to crystal formation on a longer term. This crystals gets deposited in the joints of the human body and this causes swelling and pain. Intolerable pain will be there in gout patients. So this is like 3 by 4th of the uric acid level which increases is because of the metabolism. Only 1 by 4th of the uric acid level increase is due to food. So when you are taking high purine foods such as non-vegetarians or any alcoholic beverages, it leads to increased uric acid. So this leads to gout. So it is not completely related. Like when you take high purine foods, it may lead to gout. It is not like that. It is like these foods may elevate your gout. So how we can manage gout through dietary modification? The first goal is like you have to achieve your healthy weight. Next thing is like healthy balanced eating habits you have to achieve. Next is purine restricted foods. So now let's discuss about each thing. First thing is like healthy weight. So first discuss how weight and gout are interrelated. When you are obese or when you are overweight, yeah, there is a lot of fat accumulation in your body. This leads to increased inflammation level in your body. So in gout is an inflammatory disease. Like when there is an increased inflammation and increased uric acid level, it leads to crystal formation. So when you are under a obesity category or when you are overweight, there is an increased risk of getting gout. So next thing is like when you are planning to lose weight, you shouldn't like very fastly, you shouldn't lose your weight. It should be in a gradual and slow process. When you suddenly lose weight, it has other implications also. So it is better and advisable to consult a dietitian or a health professional before trying to lose weight when you are having any gout problems. Next thing is like don't fall into trap of these fad or crash diets. These are not healthy on a longer term. It has many side effects. So next is include complex carbohydrates. Complex carbohydrates in the sense like going for millets or whole grains like bajra, rahi, jowar instead of going for refined flours. This helps to reduce your weight, and other than that, it also reduces your sugar level and fat accumulation in your body. So it's better if you go for complex carbohydrates. You have to see whether your gut is tolerating. Don't suddenly shift completely to the complex carbohydrate. Consult a dietitian and get to know what type of foods can be included initially. Next, you have to avoid processed foods and high fructose corn syrup foods which contains those kind of things. Why? Because like when there is an increased intake of sugar level in your diet, it may lead to increased inflammation. So it's better if you avoid these kind of foods. So next thing is like low purine diet. The first thing is like you have to avoid red meat and seafoods. Why? Because it's like red meats has purine content. Another thing is like it increases the inflammation. So it's better you have to avoid their intake. It's not like completely you have to avoid. Once in a while you can take, but when based on your gout level. So if it is very severe, it is better if you completely restrict on these red meats and seafoods. Second thing is like you have to avoid alcohol. Alcohol is something like it has high calorie dense. Next thing is like increases your cholesterol level also. So it's better if you avoid alcohol, and it also increases your uric acid level in your blood, and it makes difficult for the kidney to eliminate the waste products. So it's better if you avoid alcohol. Next thing is like you have to avoid sugary foods. As I told earlier, sugar increases your inflammation. So it's better if you avoid these sugary foods like processed foods or any packed foods. Whatever packed foods, just see the ingredients so that you get to know what you are actually intaking. So these are the things you need to avoid. What you have to include is like you have to include more fruits and vegetables. When you are taking more fruits and vegetables, it has a lots of fiber content. So when you are taking more of fiber, it helps to reduce weight. Another thing is like you get adequate amount of vitamin and minerals. Next thing, you have to hydrate more. Since the uric acid is something waste product, it has to be eliminated out of your body. So to eliminate something out of your body, you need to drink adequate amount of water. So hydrate more. Don't gulp 2 to 3 liters in a while itself. Give a break like 1 hour once or 2 hour once. Have a water like a glass or 2 glass of water. You can have it. So when you're following this kind of dietary modification, like high quality protein, high quality fat, high quality sugar, sugar in the sense going for complex carbohydrates, not a normal table sugar, you will get adequate amount of fiber, vitamins and minerals. Along with that, you have to take a good amount of probiotics also. In dairy, you go for a low fat dairy products. So when you are doing this, you are inflammation reduces and your oxidative stress also reduces. So this leads to increased elimination of uric acid. There is no reabsorption of uric acid. That means when your uric acid is not reabsorbed, so it leads to elimination of complete elimination of uric acid. Next thing is like your glomerular filtration rate also increases. So it means like your kidney also functions properly and it eliminates all the uric acid contents. So there is no kidney stone formation and even crystal formation also. So I think what I have told so far will be useful for you. Thanks for your time. Thanks for listening to this. And main thing is like before doing any modification in your diet, just consult a dietitian or a health professional so that they would give you a clear cut, because there is no specific or a general diet for everyone. Each person is unique. One size doesn't fit all. So it's better if you consult a health professional and then uh, doing your diet is advisable. Thank you so much.
ನಮಸ್ಕಾರ. ನನ್ನ ಹೆಸರು ಬಿ.ಜಿ. ನಾಗಲಕ್ಷ್ಮಿ, ಮೈಸೂರು. ಈಗ ನನಗೀಗ 66 ವರ್ಷ. ನನಗೆ ಸುಮಾರು ಈಗ 15 ವರ್ಷದಿಂದನೂ ಸ್ವಲ್ಪ ಮೂಳೆ ನೋವಿತ್ತು, ಭುಜ ನೋವಿತ್ತು, ಕಾಲು ಮಂಡಿ ನೋವಿತ್ತು, ಕೈ ಬೆರಳುಗಳು ನೋವಿತ್ತು. ಮಲ್ಕೊಳ್ಳೋಕ್ಕೆ ಆಗ್ತಾಯಿತ್ತಿಲ್ಲ. ಈ ಕಡೆ ಬಲಗಡೆ ಹೊರಳಿದಾಗ ಮತ್ತೆ ಎರಡು ಹೊರಡಬೇಕಾದ್ರೆ ತುಂಬಾ ನೋವಾಗ್ತಾಯಿತ್ತು. ನಾವು ಇಲ್ಲೇ ಬೆಂಗಳೂರಲ್ಲಿ ಬೇರೆ ಕಡೆ, ಅಲ್ಲಿಂದ ಮೈಸೂರಲ್ಲಿ ಬೇಲೂರು ನಮ್ಮ ತಾಯಿ ಮನೆ, ಹಾಸನದಲ್ಲಿ ತೋರಿಸೋದು. ತಾತ್ಕಾಲಿಕ ನೋವು ನಿವಾರಣೆ ಆಗ್ತಾಯಿತ್ತೆ ಹೊರತು ಆ ಮಾತ್ರೆ ಔಷಧಿ ಮುಗಿದ ಕೂಡಲೇ ಮತ್ತೆ ತಿಂಗಳಾದ ಕೂಡಲೇ ಮತ್ತೆ ಪ್ರಕಾರ ನೋವಾಗ್ತಾಯಿತ್ತು. ಹಾಗೆ ಇರುವಾಗ ನಮ್ಮ ತಂಗಿ ಮನೆ ಹಾಸನದಲ್ಲಿ ಬಂದಾಗ ಅಲ್ಲಿ ಅಶ್ವಿನಿ ಅಂಥೇಳಿ ಅವರು ಇಲ್ಲಿ ಚಾಂಡ್ರೆ ಆಸ್ಪತ್ರೆಗೆ ಚಂದ್ರಶೇಖರ್ ಡಾಕ್ಟರ್ ಹತ್ರ ತೋರಿಸ್ತಾಯಿದ್ರು. ನಾನು ಅಡಿಯೋದೆಲ್ಲ ನೋಡಿಬಿಟ್ಟು ಏನಾಗಿದೆ ಅಂದರು. ಈ ಥರ ಅಂದೆ. ಮಲಗಿ ಎದ್ದು 4 ಹೆಜ್ಜೆನೂ ಇಡೋಕ್ಕಾಗ್ತಾಯಿತ್ತಿಲ್ಲ. ಆಮೇಲೆ ಊಟ ಮಾಡೋದಕ್ಕೆ ಅನ್ನ ಕಲಸೋಕ್ಕಾಗ್ತಾಯಿತ್ತಿಲ್ಲ, ಕೈ ಬಾಯಿ ತನಕ ಬರ್ತಿದ್ದಿಲ್ಲ. ನಮ್ಮದು ತಲೆ ಬಚ್ಕೊಳ್ಳೋಕ್ಕಾಗಲಿ, ಸ್ನಾನ ಮಾಡೋಕ್ಕಾಗಲಿ, ಒಂದು ರೋಕೆ ಹಾಕಬೇಕಾದ್ರೂ ಕೂಡ ಬಹಳ ಕಷ್ಟ ಆಗ್ತಾಯಿತ್ತು. ಆಗ ಅವರು ನೋಡಿಬಿಟ್ಟು ಹೀಗೆ ನಾನು ಈಗ ಸುಮಾರು 10 ವರ್ಷದಿಂದ ತಗೋತಾ ಇದ್ದೀನಿ. ಈಗ ಒಂದು ಮಾತ್ರೆಗೆ ಬಂದಿದ್ದೀನಿ. ಅದರಿಂದ ನೀವು ಅಲ್ಲಿ ಹೋದರೆ ಒಳ್ಳೆಯದು. ಸ್ವಲ್ಪ ನಿಮಗೆ ಕಾಸ್ಟ್ಲಿ ಇದಾಗುತ್ತೆ ಅಂದರು. ಆರೋಗ್ಯನೇ ಮುಖ್ಯ ಅಲ್ವಾ, ದುಡ್ಡು ನಾವು ಇಟ್ಕೊಂಡು ಏನು ಪ್ರಯೋಜನ? ಲಕ್ಷ ನಮ್ಮ ತಲೆ ಹತ್ರ ಇದ್ರೂ ನಾವು ಎದ್ದು ಓಡಾಡೋಕ್ಕಾಗಲಿಲ್ಲ, ನಮ್ಮ ಕಾರ್ಯ ಮಾಡ್ಕೊಳ್ಳಿಲ್ಲ ಅಂದರೆ ನಮಗೆ ತೊಂದರೆ, ಬೇರೆಯವ್ರಿಗೂ ತೊಂದರೆ. ನಾವೊಬ್ಬರು ಅನುಭವಿಸೋದ್ರಿಂದಲೇ ಮನೆ ಕುಟುಂಬದವರೆಲ್ಲ ಅನುಭವಿಸ್ಬೇಕಾಗತ್ತೆ. ಅದರಿಂದ ನಾನು ಯೋಚನೆ ಮಾಡಿ ಹಣ ಎಷ್ಟಾದರೂ ಖರ್ಚಾದರೂ ಪರವಾಗಿಲ್ಲ, ಗುಣ ಆಗೋದು ಮುಖ್ಯ ಅಂಥೇಳಿ ಅವ್ರ ಹತ್ರ ಇಲ್ಲಿ ಚಾಂಡ್ರೆ ಆಸ್ಪತ್ರೆದು ಅಡ್ರೆಸ್ ತೊಗೊಂಡು ಮೊದಲನೇ ಸರಿ ಬರಬೇಕಾದ್ರೆ ಕಾರಲ್ಲಿ ಬಂದು, ಅವಾಗ ಜೊತೆಯಲ್ಲಿ ನಮ್ಮ ತಂಗಿ ಗಂಡ, ತಂಗಿ ಮಗಳು, ತಮ್ಮ ಎಲ್ಲ ನನ್ನ ಕೈ ಹಿಡ್ಕೊಂಡು ವೀಲ್ಚೇರಲ್ಲಿ ಇಲ್ಲಿ ಬಂದೆ. ಎಲ್ಲರೂ ಎಲ್ಲ ಟೆಸ್ಟ್ ಮಾಡಿ ನೋಡಿ ಆಮೇಲೆ ಎಲ್ಲ ಔಷಧಿ ಮಾತ್ರೆಗಳೆಲ್ಲ ಕೊಟ್ಟರು. ಸರಿ ಬ್ಲಡ್ ಟೆಸ್ಟು, ಯೂರಿನ್ ಟೆಸ್ಟು ಎಲ್ಲ ಆಯಿತು. ಆಮೇಲೆ 1.5 ತಿಂಗಳು ಬಿಟ್ಟು ಬನ್ನಿ ಅಂದರು. ಸರಿ ಮಾತ್ರೆ ಎಲ್ಲ ತಗೋತಾ ಇದ್ದೆ. ಅವಾಗೇ ನನಗೇನು ಅನ್ನಿಸ್ಲಿಲ್ಲ, ಯಥಾ ಪ್ರಕಾರ ಇದ್ದೆ. 2ನೇ ಟ್ರಿಪ್ ಬಂದಾಗಲೂ ಕೇಳಿದ್ರು, ಸ್ವಲ್ಪ ಪರವಾಗಿಲ್ಲ ಅನ್ನಿಸ್ತು. ಈಗಾಗಲೇ ಇದು 6ನೇ ಬಾರಿ ಬರ್ತಾಯಿದ್ದೀನಿ. ಈಗ ನನ್ನ ಕೆಲಸ ನಾನು ಮಾಡ್ಕೋತಾ ಇದ್ದೀನಿ, ಸ್ನಾನ ಮಾಡ್ತಿದ್ದೀನಿ, ಊಟ ಮಾಡ್ತೀನಿ. ಅವ್ರು ಹೇಳಿದಾಗೆ ಸ್ವಲ್ಪ ವ್ಯಾಯಾಮ ಮಾಡ್ತಾಯಿದ್ದೀನಿ. ಆದಷ್ಟು ಜಾಸ್ತಿ ನಾನು ರಿಸ್ಕ್ ತಗೊಳ್ಳಲ್ಲ, ಎಷ್ಟಾಗುತ್ತೋ ಅಷ್ಟು ಮಾಡಿಕೊಂಡು ಆಮೇಲೆ ಈಗ ನನ್ನ ಪಾಡಿನ ಓಡಾಡಿಕೊಂಡು ಇವತ್ತು ನಮ್ಮ ತಂಗಿ ಮಗಳ ಜೊತೆ ಬಂದಿದ್ದೀನಿ. ಆ ಮೆಟ್ಲು ಕೂಡ ಹತ್ತಕ್ಕಾಗ್ತಾಯಿತ್ತಿಲ್ಲ, ಮಂಡಿ ನೋವಿತ್ತು. ಈಗ ನಡೆಗೆ ನಿಧಾನ ಆಗಿದೆ, ನೋವೇನಿಲ್ಲ. ನನ್ನ ಕಾರ್ಯ ನಾನು ಮಾಡ್ಕೋತಾ ಇದ್ದೀನಿ. ಈಗಾಗಲೇ 6ನೇ ಬಾರಿ ಬಂದಿದ್ದೀನಿ. ನಂಗೆ ತುಂಬಾ ಒಳ್ಳೆಯದಾಗಿದೆ. ನನಗೆ ಹಾಸನದಲ್ಲಿ ನಮ್ಮ ತಂಗಿ ಮನೆಗೆ ಬರ್ತಾಯಿದ್ದ ಅಶ್ವಿನಿ ಅವರು ಹೇಳಿದ್ರಿಂದ ನಾನು ಬಂದೆ. ಈಗ ನಾನು ಕೂಡ ಎಲ್ಲ ಕಡೆಯೂ ಹೇಳ್ತೀನಿ, ಏಕೆಂದರೆ ಇದರಿಂದ ನಮ್ಮ 100 ಜನ ಎಲ್ಲ ಪೇಷಂಟ್ಗಳು ಕೂಡ ಹುಷಾರಾಗಬೇಕು, ಅವ್ರ ಪಾಡಿಗೆ ಅವರು ಚೆನ್ನಾಗಿರಬೇಕು. ಡಾಕ್ಟರ್ ಚಂದ್ರಶೇಖರ್ ಅವರು ಬಹಳ ಚೆನ್ನಾಗಿ ನೋಡ್ಕೋತಾ ಇದ್ದಾರೆ. ತುಂಬ ಸಂತೋಷ ಆಯಿತು. ಧನ್ಯವಾದಗಳು.